Okay, good afternoon, everyone. I'm going to be taking over now and go over just a few tips or tricks for the exam and what to expect on your exam day. Since I recently did my exam myself, and when you sign up for the exam, they will make you sign a confidentiality agreement, which stops you or prevents you from sharing any details that are specific to the exam. However, you are allowed to share general information about the exam. I'm just going to go about the general information before I start with explaining what to expect, etc. Um, when you book your NAC OSCE exam and you're going in for the exam, think of yourself as a physician. You're no longer a student. I'm sorry to say it like this, but you're not a student anymore. If you go thinking like you're a student, you're going to fail the exam. Go in like a physician going to his clinical day or to his clinic, going to work in your own clinic. What would you expect when you're working as a clinician in a clinic? Think of exam like just a regular clinical day for a physician working in clinic or a general physician. In exam, you can be tested on medicine is a really broad topic. You can be tested on anything. You can be tested on emergencies, non-emergencies, giving bad news, explaining a condition to a patient, explaining why they have to stick to their medication and take the medication regularly. You can be tested in as many ways that you may see in your clinic or you can expect seeing in a clinic. Uh, Therefore, if you're going to the exam, don't think like you're going to be tested just on how to diagnose or how to treat or how to uh, what tests to order. You will be also expected to know how to talk to the patient, how to explain a complex medical condition in simple layman terms to a patient who doesn't know what those terms means. Remember, your standardized patients are not going to be physicians themselves. Most of them are actors or paid people who come in to just be the patient, and they have a specific script or specific instructions that they have to follow. Anytime that you're doing something and they don't feel comfortable with it, they will stop you right there. They are going to help you in the exam, but you have to be able to make them or elicit a history, do a physical exam, making sure they're comfortable before you start your exam. This is some of the expectations of the exam. Exam itself has 12 stations. Two of the stations, they're pilot stations. They do not count. Each station is 11 minutes. Station can be 11 minutes of history taking, 11 minutes of counseling, uh, 4 minutes of history, 4 minutes of physical, and 3 minutes for counseling, 8 minutes history, 3 minutes talking to the examiner. Any format is possible in the exam. You will get a video link to an orientation that explains all these different expectations that are there from the IMGs. Now, when it comes to physical exam, you may get a station where you have to do a full physical exam of a specific organ system, let's say cardiovascular system, or you will get a station in which you have to take history, and based on that history, you have to do focused physical examination. Now, if you get a general physical examination, you can do all those all those general tests and routine tests and maneuvers, things like, for example, let's say uh, if you get a general knee examination for knee, there are anterior drawer test, posterior drawer test, Lachman test, McMurray test, so many tests that you can do for just the knee. But if they ask you or if they give you a patient who has a specific condition, then your physical exam should be to determine or to rule in or rule out your differential diagnoses. Um, for example, let's say you get a patient with headache. Now, if you're suspecting primary headache, physical examination is going to be uh, almost normal. There may not be any abnormality. If you are suspecting that there is something serious going on and you want to do a short examination, so you can do a quick neuro check, etc., to make sure there is nothing serious going on. Once again, your physical exam part could be general exam of the organ system or specific to the history of the patient. If it says take history and do physical examination based on what you're suspecting from the history, that's what your physical exam should cover. You shouldn't be doing anything extra. It's going to take your time. They may not reduce your marks for doing an extra test, but if the test is invasive or causes discomfort to patient, you are probably going to lose your points. So make sure from the history you know what you're looking for, and based on your history, you optimize and narrow down your physical examination to your history. Let's say you have a patient who comes in with a condition that is emergency. In those cases, you can take the history very quickly and go to physical exam and stabilization. Vital signs are either going to be given to you from the STEM, or you can ask the examiner. You don't have to like address them by name, sir or madam or anything. You can just say, do we have a set of vitals for the patient? And they're likely going to provide you the vitals. Uh, Make sure if you have patients who you think are emergent, make sure you ask for vitals if they are not provided. This is an expectation to see if you know what patient takes priority. For anything that's emergent, always it's going to be your ABCs. Remember your ABCs: airway, breathing, circulation. Make sure you're addressing any abnormalities in the vitals based on patient presentation and the abnormality that you saw. For example, we're back. Now, like I was saying, if you get someone or a patient who has an emergency, and from the STIM, you saw that patient is presenting with something emergent, like a road traffic accident or a patient with a gunshot wound or a stab wound, make sure you are prioritizing abnormal vitals and adjusting your examination, physical examination, and your treatment plan according to the patient. Once again, these are things that are expected from you. They see you as a physician, they do not see you as a student anymore. Therefore, the expectation is that you know what you're doing. If they're giving you a case of emergency or emergency medicine or urgent cases, they expect you to behave like a resident or a physician who is working in the emergency room, and they know what they are doing. Once again, so to recap, uh, comfort for patient, Dr. Jala already covered these things. Patient comfort, covering patient enough, exposing enough area that you need, avoiding intimate exams. But if you think the intimate exam, let's say you think that you need to check patient's rectal tone based on their other neurological findings, you don't have to do it. You can't do it. Patient won't allow it. The examiner will tell you to stop. The patient will tell you stop. What you can do is verbalize. At this point, to complete my neurological exam, I need to do a rectal tone check or rectal tone assessment from a digital rectal exam. The examiner will either tell you normal or abnormal, negative or positive. Another thing that I want you to keep in mind is patient safety. Let's say patient comes in with uh, incoordination or loss of coordination or ataxia, anything like that, and you're asking them to walk while you're sitting away from them. This is a safety hazard. Patient can fall, and if they fell uh, while you're doing the examination and you're not there to balance them or to give them support, you're going to fail that station. It's going to be considered an automatic fail because you're endangering your patient. Um, Hand sanitizer is usually provided. Um, Anyone who is taking the exam, I would recommend doing a certificate. They call it hand hygiene. It's, I think, $8 to register for. It is good for 1 to 2 years. Hand hygiene is what is going to tell you what's the expectation from someone working in healthcare in Canada. How many times do they have to do hand hygiene with the hand sanitizer? When do you have to do hand hygiene with soap and water? to go over the general details of hand hygiene certificate. So the expectation is when you're entering patient room, you do a hand hygiene. When you are in the patient's environment, you do hand hygiene. If you are touching the patient, you do hand hygiene. These are the expectations. But since examiner cannot see you in Nagoski outside the room, there is no hand sanitizer outside the room. You're going to be going into the room, handing your paper to the examiner, and then doing your hand hygiene before you start conversation with the patient. Once you're done and you're starting, you took history, let's say, and you're starting physical examination based on your history, you are expected to do another hand hygiene before you start touching your patient. They provide you hand sanitizer in the room. They will give you the reflex hammer, the light for if you want to do pupil exam, and other necessary supplies. The only thing you need to do is take your own stethoscope with you, because they don't like sharing things that are going to go into an orifice, or for example, your ears. You can get infection, they can get infection, therefore it won't be provided. You have to take your own stethoscope. You don't need to take any pen, anything else, just your exam ID and a stethoscope and a white coat. That's it. Wear business casuals or formal clothes. No scrubs for exam day, unless you have an exception from MCC. If you have any accommodation or exception, email them or let them know beforehand. I think you have a specific timeline that you can ask for accommodations. Let's say someone who gets panic attacks, you can ask them to allow you to have your medicine on you in case you start having a panic attack, so you can take the sublingual alprazolam, however you treat it. If you have a health condition that requires you to take medications on a schedule, let them know. They will allow only those medications. They won't allow you watches, they won't allow you jewelry, they won't allow you any accessories. Only you, your face, your formal dress, and a white coat. And they will give you pencils and notebook to take notes on. Once again, use your time before entering patient environment smartly. Write down what you are going to do so that you don't miss it. Examiner, standardized patient, they understand you're stressed, you're under pressure. They will not like make you feel uncomfortable if you're checking your notes. You can verbalize it. I'm just going to take notes, and so that I don't miss anything. This way you're covering yourself, and if you look down, they would know that you're just trying to take notes, not cheating from the paper. And another thing that I want you to know about the physical exam: you cannot do rectal exam, you cannot do pelvic exam, you cannot do breast exam. These are fully banned. They are not going to allow you to do this. You will get in your orientation that you cannot do these intimate exams. Any exam that involves putting your finger in an orifice, nose exam, they won't let you do it. Mouth exam with your finger, they won't let you do it. In case they want you to use an equipment, they will provide you the equipment. For example, if they want you to use an otoscope to do an ear exam, they will let you do it with an ear exam, but they won't let you uh, put your finger into patient's mouth, their nose, or rectum, etc. Therefore, these are some of the examinations that you won't be doing. But if the station requires any of these examinations, let's say you're suspecting a patient has tonsil stone or tonsillar abscess, and you want to check their tonsils. Now, one of the method is to use a tongue depressor to look clearly. You would verbalize it. If they want you to do it, they will let you know, please go ahead. Otherwise, they will stop you and tell you normal or abnormal. That's pretty much the exam. Another thing, like I was talking about safety, if patient has any difficulty in walking, their gait is disturbed, anything, ask the patient to sit down or have a seat or lay down. Stop your exam right there. Let the examiner know that you're going to do toe walking, you're going to do heel walking if you think that the patient could benefit from it. However, you do not want to cause injury to patient, therefore you're not doing it unless there is something abnormal. That they will let you know if there is anything abnormal, or they will let you know it's normal. Once again, if you're doing a patient's examination and you're asking them to walk for you, or you're asking them to stand up, for example, if you're doing cerebellar sign, asking them to stand with their feet closed and eyes closed, and you're trying to induce ataxia in the patient with that, They want you to stay close to the patient and let patient know that you're going to be next to them to hold them in case they lose their balance. This is an expectation from you. You have to verbalize it to the patient. I need you to stand up for me. Please bring your feet together and close your eyes. I'm going to stand right next to you and hold you or support you if you lose your balance. Let the patient know that you're working on their safety. You're making sure they are safe, they do not fall. And this will also point to the examiner, you know what to do, and you're behaving like a family physician or a physician who is practicing. Once again, I would like to reiterate this one point. When you're going to the exam, you are going as a physician, not as a student anymore. They consider you a physician. They consider you someone who knows how to run a clinic or an emergency room, and they expect you to behave that way. If you see patient's vitals are abnormal or there is something emergent, follow your ABCs, airway, breathing, circulation. If you see that an examination may cause discomfort, um, verbalize that I'm going to do this, but it can cause discomfort. Let the patient know that it may be a little uncomfortable. If the examiner doesn't want you to do it, like Dr. Jala gave you the example of Sperling's test, if the examiner doesn't want you to do it, they will let you know normal or abnormal or positive or negative. They won't let you do tests that could cause harm. Once again, for the class, we would be mostly pretending, for example, palpation of abdomen, chest, etc. But in real exam, they may expect you to actually do the palpation, but when you're doing it, make sure you're not pressing too hard, you're not using fingertips, you're using the pads of your fingers to make it comfortable. You're pressing with enough pressure to elicit tenderness if there is any, but you're not causing too much pressure to harm the patient or cause them discomfort in actuality. And keep in mind, each standardized patient has to see about 50 or 12 IMGs. So if every IMG kind of squeezes their fingers into their abdomen, it's going to be uncomfortable for them. So make sure if you're required to do palpation, you use the finger pads, not the tips of the finger. Your nails are well maintained. This is also an expectation from physicians that you have your nails maintained, your hygiene is fine. Do not use any nail polish, etc. They don't like those things. Use the pads of your fingers. Be gentle, but make sure you actually do the maneuver. Don't expect them to give you a positive finding if you're just doing this. Apply gentle pressure. Make sure it's comfortable for the patient. Don't overdo it, don't underdo it. Make sure you're actually doing the maneuver. Avoid unnecessary physical exams or maneuvers. This may not give you extra points. It can negatively impact your performance. If you're doing, for example, someone has an injury of their leg and you're doing an auscultation of the chest, then it kind of makes it hard for them to believe that you know what you're doing. They want you to go and focus on what is happening with the patient. If someone has a sprained ankle, they don't want you to do a respiratory exam. They want you to do an ankle exam. Don't do unnecessary maneuvers. Don't do maneuvers that are not going to yield anything based on patient's history. If they give you a full physical exam of a specific system, then they are expecting you to be doing a wellness check. And wellness check, patient doesn't have any symptoms. You're doing a wellness check that is, or a physical exam to check for if there is any abnormality that can be accidentally found. For example, most people may feel fine, but they would have a benign murmur or a murmur that's concerning. Now, normally it wouldn't be identified if they do not go for a wellness check. So if they give you a full physical examination, 11 minutes or 8 minutes, they expect you to do a full thorough exam. For example, if you're given a cardiovascular exam, they want you to do pulses on both sides, expect the pulses, do capillary refill, do inspection, auscultation, palpation, and or percussion, because percussion for cardiac symptoms is not very specific. The only positive finding that you may get from percussion is that the cardiac margin or the area where the dullness is on the chest may be slightly shifted in cases of massive cardiomegalies, but Normally, percussion would not yield anything positive for cardiovascular system. These are some of the expectations from you. Once again, you are going in as a doctor, work like a doctor, think of your exam like a clinical day. You're going to see your patients. Um, don't be shy to ask questions, even if you feel like this question may be very intimate or personal. Let them know that this question may be personal, but ask if you think it's needed for the station you're doing. If it is not needed, it's unnecessary, they will let you know they're not comfortable answering these questions. Stop. If the standardized patient is uncomfortable with anything, they will stop you. They have been trained like this. If any maneuver or anything is causing them discomfort or anything, they will let you know to stop. The goal is to elicit positive findings without causing actual discomfort to the standardized patient. If you cause actual discomfort, I think that's considered a unsafe practice, and unsafe practice is an automatic fail on that station. All right. Hope this helps. We can start practicing now.